guys, welcome back to my channel. My name is Wendy if you are new here, and I am a registered nurse. I'm currently a family nurse practitioner student, and on this channel I share my nursing advice, my nursing journey, as well as bits and pieces of my life. So if you're interested in any of that type of content, then make sure to subscribe, ring the bell for notifications so you don't miss any of my future videos, and let's get right into this video. In today's video, I wanted to share with you guys tips on what it is that you can do to prepare to meet a potential clinical preceptor. So if you guys don't know, I actually have found a women's health clinical preceptor, and it is a medical doctor who agreed to precept me. I actually found her through Google, and I did a lot of cold calling, and she decided that she wanted to meet me before she gave me a yes. So that's why I'm going to be sharing with you guys my tips on what you need to do to prepare, and I'm also going to be sharing with you guys the questions that she asked me so that you guys also have kind of an idea of what it is that a potential preceptor can ask you. So the first thing that you need to do is review your clinical website, whatever website it is that you use. We use In Place to submit our clinical preceptor information. So what I did the night before, because it was very last minute when she decided to meet me, so like literally I called her to follow up one day, and then the next day they said, okay, come in and meet her. So it was very last minute, but what I did was I went into my In Place and I made sure that I had all the information that I needed from her. So I wrote it all down in a Word document, and I printed that out. So her, like, any information I needed, her office address, her MD license, all of that information, I wrote it all down in a Microsoft Word document. I left her space to write it in so that when she gives it back to me, I could just look off of that and enter it into my In Place. So that's the first thing I did. The other thing I did is I made sure that I printed out my preceptor agreement form. So make sure that when you go to meet this clinical preceptor that you've taken all the paperwork that you need, that the school is requiring you to submit, so that you have all of that and you're not going back and forth scrambling around. You need to be organized, like very organized. If you go there unorganized, you're gonna look bad. Like, you want to make sure that you have your stuff together so that you give off a good impression. So print out everything, take everything that you need, all the documentation that you need from your school, and take it with you so that at the end, when they say, yes, I will precept you, then you have it with you. So the second thing that I did as well is I made sure that I took my resume and my letter of recommendations. I took 2 letters of recommendations from providers who I had worked with in the past. Now, when I made the appointment to meet her that day, they didn't ask for me to take resume or letter of recommendations. They didn't ask me to take them. I decided on my own that if I took them, then it would be more like professional, and at the same time, maybe they'd be more at ease to know that there's other providers who recommend me. So that's why I took those letters as well. Something that I think is also important is to take your student ID. You know, when you're in the NP program, they will provide you with a student ID. Now, she didn't ask me for the ID, but I took it anyway just in case she asked. Like, you just never know. So I took my student ID, and please take a pen, because I'm sure that something will come up and you'll need a pen. So take a pen or 2 pens with you so that you have them and you just take them out of your purse and do whatever it is, take notes or whatever, and just be prepared. I don't even know if I'm on the 3rd tip or the 4th tip. I don't know, you guys. But dress professional. Dress like you're going for a job interview, because this is pretty much a job interview. You're not getting paid for this job, but you got to be prepared and you got to look nice. You got to dress professional. So dress professional, groom yourself, please. Like, don't go looking crazy. Make sure that you arrive on time. Make sure that you are confident and you answer confidently. The other thing that I would advise is that you talk about your schedule. Most importantly, make sure that you ask the potential preceptor if they're going to be going on a major vacation during that time, because that would suck if you are just counting on this preceptor and then they have this major vacation planned. So make sure you talk about that. We talked about that, and thank God she said she didn't. But also make sure that you tell them when it is that you need to submit your paperwork by, because to them, you know, it's kind of weird, because I feel like my school wants it 4 months before, and I feel like sometimes the preceptors, they don't understand that you need it at that time, and they're like, no, just come back to a closer time. So just make sure that you tell them when it is that you need it, and I'm sure that if they're willing to help you, they'll submit that information to you before it's due. So make sure you tell them about that too. Now, also, I went in thinking I want to do clinicals every Friday because that's my work schedule. But she told me that she wanted me to go in twice a week. So I was like, oh my God. But obviously I can't say no because I need my clinical hours. So I said yes. You know, let me know what works for you and I'll work my schedule around your schedule, because you're the one volunteering your time. You're the one giving me this opportunity. So I'll do the sacrifices that I need to do on my end in order to meet in the middle and, you know, fulfill those clinical hours that I need. So make sure that you guys talk about that. And of course, most importantly, always thank them for their time and the opportunity that they're giving you, because not many people want to do that nowadays. I feel like it's so hard to try to ask for somebody to give you a little bit of their valuable time to precept you. And so yeah, make sure that you're very grateful and that you're always honest with what it is that you are answering them when they ask you questions, because, you know, people are smart, you guys. They catch on really fast, and you have to be honest, say thank you, be grateful for the opportunity, and that's gonna take you like a long way, and it'll make them feel good that you are grateful and that you appreciate that they're doing this for you, because they're doing it because they're volunteering, you know? It's not like they have to do it. So be grateful and thankful always. Okay, so moving on to the questions that she asked me. Honestly, when I went into the interview, whoa, I was a little unprepared for all these questions, because I mean, they're common sense, but a lot of these questions I just didn't know what to answer. Like, I don't have an answer right now. Like, I'm just trying to make it through school right now. Like, I don't know what I want right now. And she asked me some of these questions, and I'm just gonna read them off to you. So first, she told me, tell me about yourself. Number 2, is the program mainly online? Number 3, how many years have you already been in the program? Number 4, how did you hear about me? And you guys, I found her on Google. I think I already mentioned this with you guys, and she was so surprised when I told her that I read her reviews and everything. She's like, oh my God, nobody has ever told me that. But I was being honest, and she appreciated that. So number 5, where do you currently work? And then I told her about what I do in my current role. She actually really appreciated the fact that I had experience both in inpatient and outpatient nursing. So that made me feel good. Like, she didn't look down on me because I was working in an admin clinical job, and that just made me feel so comfortable. Now, with that being said, she was taking notes on her laptop as I was responding to her. So that's a little like scary, but she was doing that. And she did also mention that she likes to meet the student and find out about their background first so that she can better assist and understand during the clinical rotation. So I thought that was very nice of her to take that time to get to know me a little bit more, and, you know, just made me feel more comfortable to know that hopefully I'm going to be having a like wonderful clinical experience with her. Moving on to question number 6, she asked, what specialty do you want to work in after you've completed the program? know. I don't know what I want to do. And I was honest. I honestly told her I don't know what it is that I want to do, what I want to work in. I kind of want to just figure it out during my clinical rotations, and she was okay with that. She did also ask me if I was bilingual, and she actually, which I told her I was, and she actually gave me a potential lead for internal medicine. So that's pretty cool. At the same time, you're kind of networking. So she did tell me like, hey, you should reach out to this provider because they have a lot of Spanish speaking patients. And I was like, oh, okay. So I'm gonna reach out to him probably for August. Question number 9, we talked about the schedule. And once again, of course, be as open as possible with your schedule and work around their schedule. I know it's a very like common sense questions, but I was very unprepared for them because I don't know what I want right now. I don't know what specialty I want to work in. I don't know. So I hope that you guys enjoyed this video, and I hope that you guys found valuable information in this video. Make sure to give it a like if it was valuable information to you, and also make sure that you subscribe right here and that you also check out these videos right here. But anyways, I hope that you guys have a wonderful day, and I'll see you on my next video. Bye.